Thank you so much. My name is Sara Jane Griffin. I'm the fundraising manager at NF Northeast. Thank you so much for having me here. I think if I had realized who was going to be in this room today, I would be a lot more nervous. I was trying to come up with an analogy for this gathering. And the best thing I could come up with was a Celtics-Lakers game in the late 80s when you had Hall of Famers elevating the game of basketball to another level. Well, in this room today are the Hall of Famers of medical professionals who have elevated diagnosis, treatment, research of NF. And just as we were very lucky to watch Larry Bird and Magic Johnson elevate the game of basketball, we are really lucky to have these medical professionals in our corner. And to be here in the same room as them is really pretty incredible. So it was thrilling to hear them, to hear some where we started with NF and where we are today. What I would like to do is talk about NF Northeast. Our vision is for a world without NF. Our mission is to help NF patients, families, and caregivers on their journey with NF. And that takes many avenues. We are dedicated to assisting as many people as possible. We offer programs for the entire NF community, whether you are a patient or a family member, a professional or a caregiver. Wherever we find a need, we strive to provide support. Our region is Pennsylvania northward, but if anyone reaches out to us, we try and help, no matter where they live. NF is not limited to simply the Northeast. We will help anyone where they need it. We have offices in Burlington, Massachusetts, which is where I work. We have offices in Buffalo, New York, as well as our newest one in Westchester, New York, just outside of New York City. And that really affords us the opportunity to make connections with clinics in those areas, with patients in those areas. I know that working in the office almost every day, it's such a pleasure to be able to answer the phone. Someone calls you up, we answer. You talk to me. I don't always have the answer for what you're looking for, but you talk to a real person. And if I don't know the answer, I make sure I have your name and telephone number and we get back to you. We offer a lot of support programs. These are just a few of them. You know that there's a table outside with a whole bunch of information about our programs. With summer coming up, there are camps available around our service area. We offer scholarships for people who are graduating from high school. My favorite program that we provide is something called Matched for Hope. So if you are a patient, a family member, a caregiver, and you have either recently found us or found out about a diagnosis, we can match you with a trained peer. And you would be matched based on diagnosis, situation, and you would have somebody to talk to on your journey. And how great is that? You just come back from an appointment and your head's spinning. You have someone to pick up the phone and talk to who has been in a similar situation. So that Matched for Hope program is really wonderful. We also have 2 programs that we do over Zoom, which is wonderful because, again, we're a big area. One of them is our community chat. It's a safe space for patients to talk about their NF situation. Maybe it's an opportunity to vent, ask questions. We offer this over Zoom, so again, safe space. And our Tuesday takeaways, which is an amazing educational program in which we provide a forum for NF professionals to share their knowledge. It happens on Tuesday, I think like the third Tuesday of every month, except maybe the summers. And it's via Zoom. So, yes, we have had people in their office, in their home, in their car, listening to our professionals speak. We do not record these programs because we are concerned with patient confidentiality. So as much as we would like to share that information, we encourage you to join the conversation. This slide deals with advocacy. And for some of you out there, you may know that actually Karen Peluso from NF Northeast was the first person to go down to Washington, D.C. and ask for funding. I mean, how incredible was that? Look at that number. $650 million, because the entire NF community from around the country would get together and meet down in Washington, D.C., as we did this past February. And we went and we visited as many senators and representatives that we could. And we said, this is so important. We asked for $25 million to fund the Department of the Defense and NIH. In the past, that research has led to those medications that are now treating NF. And yet this year, gone. $25 million cleared off the books. The impact of that will not be felt for a while, but it will be felt. So we are working now on 2026. And there is an opportunity for your voice to be heard. It's very easy. You make a call, you make an email, or you write a real letter to your congressman or senator in Washington, D.C. I would encourage all of you to do that. It takes about 5 minutes, and the impact could be profound. We have a list out at the table where I am. You can put your name and email and where you're from. Had a wonderful conversation with somebody from Maine. Every location is important. Sign that sheet of paper. We will be in touch with you. This is incredibly important. If you would like more information about advocacy and about funding, I would encourage you to talk to John Manth. John, can you raise your hand? John's an expert, and he would be happy to explain that to folks. So thank you. So we do funding. That is part of our program. We're not talking millions of dollars, but it is funding. We have most recently funded Francisco Fernandez at the Harvard Medical School Walker Lab. You guys have an opportunity to see it. I did see it a couple of years ago. Go. What an amazing learning experience that is. This past year, we funded Dr. Lehman and Dr. La Rovere at Boston Children's Hospital. They are studying identifying moya, MRI, and TCD in children with neurofibromatosis type 1. I can't tell you anything about that. I don't really understand it. All I know is we do our best, and the money that we raise goes towards funding research. We are not the government, so we're still giving out money. So that's really important. Now, My job. I work on fundraising. These are some of my events that I do. And these are great. Fundraisings are really important because we can't do our work without raising the funds. I was at my New Jersey walk last weekend, and we had a character. We had a minion there to add a little something fun to the walk. And I said to the kid who was the minion, I explained what NF was, and I said, I'm asking a favor. When you go back to school on Monday, you tell people where you were today. Tell them what NF is and tell them that it is a rare disease and that you were here and you learned about it. That's the awareness that these events bring. You all can do this. On Monday, people say, oh, what'd you do over the weekend? Oh, I went to an NF symposium. Oh, what's that? Now, if they're your good friends, they probably know. But there may be other people you encounter that do not know what NF is. It should be your job to raise awareness with everybody you meet. Just as, I do. Just as the people who come to my events, I ask them to do it as well. So let me tell you about a few of these. Oh, I forgot to wish you Happy NF Awareness Month. We have our own month. I mean, pretty cool. And this is when we have our Steps to Cure walks. We have 9 this year, up from 7 last year. Last Saturday, New Jersey. Sunday, we were in Buffalo, Westchester, New York, as well as outside of Philadelphia. Today, we are in Camden, New York. Saturday in Hartford, Sunday in Wakefield. We get Memorial Day weekend off. Then we're up in Lebanon, New Hampshire at Dartmouth Hitchcock. And then the next day in Capital District, Schenectady, New York. And we are doing great guns. We are raising so much money. We have exceeded our goal monetarily. We have exceeded our goal for walkers. Our goal was to have 800. We are now at 809, and we continue to register people for our walk. So that is a very important part of our program. We do a Coast to the Cure cycling event. There is an event in early September around Cape Ann, Massachusetts. We have a whole series of endurance events. If you are a runner or know of a runner, put them in touch. We have things going on. I also want to pop up to this last thing that is noted here, which are our meetup events. We had a meetup event in outside of Hartford this past winter, and we have people who come to these events who have never met another NF patient before. Fascinating. And here we get to bring them together. That event was actually run by a volunteer. Those bring us great joy so that people know they are not alone. Is our inspiration. These are the people. This is the reason I get up in the morning and go to work and enjoy every moment of it. I could tell you stories about every person in this picture. They are adults. They are young children. They have known they've had NF for a long time. They have been recently diagnosed. And they each have a story. And so exciting to be part of that story and to bring them some type of relief in their journey with NF. These people serve as volunteers. They serve as advocacy partners. They participate in our fundraising programs, and they truly are the motivation why we do what we do. As I said earlier, I am right outside in the table. Please come and see me, grab my business card, make sure you sign up for one of our, sign up for a program, just make sure I have your email address. I'm happy to answer any questions, and if I can't answer your question, I will take your email or telephone number and I will get back to you. Thank you for everybody who put on this wonderful program. Thank you all for coming out and dealing with traffic and the weather. And thank you. Pleasure. Thank you.